remember my first day as an intern, brand new on the hospital wards. It can feel really intimidating. Not everything you need to know is taught in medical school. It can really feel like it's sink or swim out there. So I'm going to teach you some skills to stay afloat. Number 1, stay organized. It can't be said how important this is. So one tool I like to use is a scut sheet. A scut sheet is essentially a way to shorthand record all the information that you need for your patients to present on rounds. It often has a one-liner about the patient, essential medications, and then a fishbone diagram to help you keep track of their daily labs. Some people use a scut sheet for one patient each day, and others will have one scut sheet per patient per week. You should also really sit down and map out your day. The hospital workflow can be really hectic. So you go from pre-rounding to clinical rounds, and there's the time after rounds. You really have to know how much time to budget for each thing. In a typical day in the hospital, you'll often have around 2 hours plus or minus to plan your pre-rounds. So that includes getting the vital signs, looking at labs, reviewing all the notes that happened in the interim since you were last there, and kind of seeing all your patients and putting together your tentative plan that you want to present on rounds. After that is rounds. That can take anywhere from 2 to 3 hours, depending on your attending style. After clinical rounds is the time to meet with your team and prioritize tasks that need to happen for your patients. Sort these tasks into 2 buckets, urgent tasks and non-urgent tasks. So after clinical rounds is the rest of your day. This is time for you to get all the tasks done that are needed to really advance care for your patients. So that might be placing orders in the computer, calling consultants, going back to see your patients to see if there are any interval changes since you last saw them, or calling family members. There's just so much information that we're supposed to gather and keep track of as new interns, so you can really get buried under all of this. It's so important to stay organized. Moving on to tip number 2, master a handoff system. As we do more and more shift work these days, you'll be asked to hand off your patients very frequently. And errors can happen in those periods of communication. It's so important to have a standardized system for how we communicate with other providers about our patients. Multiple studies have shown that having a standardized handoff tool can really help reduce patient errors, such as giving the wrong medications, anchoring on a wrong diagnosis, or even missing the diagnosis completely. So I have one system that I like to use called the 5 S's. This stands for severity, story, steps, situation, and say it back. This is just one system among many, but I find it to be helpful. So S number 1 stands for severity. One quick statement to capture how sick your patient is. The next S is story. That's really a quick summary of who your patient is, why they're in the hospital, and what's been done to treat them so far. And then the next S is steps. So these are next steps to help guide the person covering your patients to know what they need to do to advance your patient's care. The next S is situation. This is really planning for the worst possible scenarios for that particular patient. What should that person taking care of your patients anticipate next? The last S is say it back. This is a way to make sure that you have closed loop communication between you and the provider that you're handing off care to. So saying it back might just be simply asking the person you're handing off to, what are the key elements of that patient's case and what things do they need to do that night? So there you have it. Now you have a system to help you reduce patient errors and hand off your patient care safely. So tip number 3, have a systematic approach to common symptoms you'll find in the hospital. These often include pain, nausea, and constipation. So a best practice is to always ask yourself why. Why is the patient having that symptom? And why does the medication you're thinking about work? You want to really think about this so you can target the underlying reason for your patient's new symptom with a medication that really gets at that. Here's an example. So opioid-induced constipation. It's so common. Why does it happen? With opioid-induced constipation, it's a slowed colonic motility disorder. So now you can target it directly with pro-motility agents like Senna or Bisacodyl. If you didn't know this, you might actually lose a hospital day trying other things like osmotic laxatives that may not work as well as a pro-motility agent for those patients. So always ask yourself why. If you always ask why, you'll get to the root of the problem. So there you have it. If you want to learn more about systematic approaches to skills you need for intern year, check out my full course at MedMastery. And don't worry, being an intern can be really scary at first, but it is also so rewarding.